very taxing physically, emotionally and financially for so many Victorian families. And that's why it's really important that we've got a system in place that Victorians can have confidence in. Today, health ministers agreed that our departments would commence a rapid review to consider the way in which we can implement an independent accreditation body. They will also consider whether the state regulatory schemes that we have are fit for purpose when it comes to safety and quality, and they will also consider options as to whether or not we progress a national scheme. Quite frankly, the key issue for me has been around the accreditation of fertility care in this nation. At the moment, the fertility care providers are self-accredited through an organisation called the Reproductive Technology Accreditation Committee. And it simply doesn't pass the pub test that the people that provide the service are also the ones that determine who provides the service. So we've got work to do there, and I was pleased with the outcome from today's Health Ministers' meeting.
So will that mean, are you looking at a model that brings states more in line, or are you looking more at a model that will have one national health regulator?
So we have had leading regulation here in Victoria for some time, and all states are on a different part of that regulatory journey. For instance, WA is only now implementing regulation. So the work of the health departments is to consider where each state is up to, and so that we can consider how we can strengthen quality and safety.
It is only this year that Victoria's moved to a new health regulator in this space then. Is it too late to be clearing that up, or is this a sign that probably needed to go stronger when Barker was at?
Oh, well, no, I'm not suggesting that at all. As I've said, I think the key issue here has been who accredits the providers. And right now, that is the industry itself. So RTAC is the accreditor and licensing agent of fertility care providers, and RTAC is an organisation that represents industry. And the Fertility Society of Australia actually commissioned their own review a couple of years ago that recommended that we move to an independent accreditation system. I pushed hard for that today, and I'm pleased that the agreement is that the states will now look at doing that.
How quickly are you planning on implementing that body?
So we've asked for a 3-month rapid review. But can I say I'm well aware that right now Victorians want to see action, and that's why the health regulator here in Victoria is undertaking an independent investigation into what has gone wrong at Monash IVF. But we've got to move quickly. I went into the meeting today with a view that we should move immediately to implement an independent accreditation process, but Health Ministers works on a consensus model. Queensland have just made some changes to their own legislation and were not persuaded of that view in the room, but nonetheless, I'm still pleased that we've got this 3-month review.
So just to confirm though, it's not guaranteed that there will be